there's one key quality that's missing in the physical therapy world. Before we get into it, I want to make sure that you stick around for the entire video. We are not only going to talk about the problem, but then we're going to discuss the solution so that way you can make sure you're not falling into this in your day-to-day work. Now, to me, the number one missing quality is having high standards. I don't necessarily think it's our fault completely. I think the structure of the traditional physical therapy world tends to create this. So really the insurance-based world. The structure around it, having rules and regulations, the volume of people that we see over time starts to lower the standard of care. I think we can do better than this. But the first step is understanding that that's happening. We can't change something unless we're first aware of it. So ask yourself, is the standard of care lower than you think it should be? And it's okay if it is. Just identify, be aware of that. And what I want to do to help really draw this out is walk through a lower standard of care treatment compared to a higher standard of care treatment. That way we can start to compare and contrast. And if you're on the lower side, that's totally fine. Let's think of strategies and let this be the catalyst to start to raise your standards. All right, let's go through it. On the low standard of care, let's say we have a low back pain assessment coming in. The low back pain assessment, from that, we identify tight and weak muscles. Maybe they have tight hips and weak abs. But overall, we tend to identify tightness and weakness. Next, we treat the condition. So we have a low back pain patient, we now treat a low back pain patient. What does that typically mean? That means that the 5 low back pain patients we just saw, we're now doing the same exact exercise for that person because we're looking at it as this is what I do with low back pain patients. These are my 5 exercises I do for every single low back pain patient. Next, the result of that is short-term results. Because is that really the best for that individual? Sure, they have qualities that are the same, but everything needs to be tweaked and modified to meet the person where they're at and their structure. And we're going to talk about that. So we get short-term results of that. Producing short-term results over and over and doing all the same exercises over and over and identifying tight and weak muscles over and over leads to physical therapy burnout. We go through the motions, and a result of feeling burnout is going to continue to lower our standard of care. It's a vicious cycle, and I think we just first need to be aware that that cycle may be happening. So that's kind of our lower standard of care. What's the big picture here? The big picture here is that we're only looking at tight and weak muscles. We're doing the same exercises for everyone based on the condition. We get short-term results, we feel burnt out. Can you relate to any of that? Maybe, maybe not. And it's okay if you are. We're going to use this video to raise our standards and start to elevate our level of care. Next, our higher standards of care. What's going on here? Well, we have a low back pain patient, okay? So it's the same type scenario. Instead of identifying weakness and tightness, we are now identifying a pattern and position. What position is that person in that is probably creating their low back pain? How do I want to optimally change their pattern? They're in a pattern. If you're working with chronic back pain, they're in a pattern that's driving that back pain. It's up to us to change the pattern so we can get them the results that they're looking for. So we're identifying patterns and positions. Next, we treat the patient and the structure. This low back pain patient is getting something different than the previous low back pain patient, who got something different from that low back pain patient, who then got something else different. The exercises may be similar, but the way that we're coaching, the cues we're using, the setup, the breathing strategies, all of this comes into effect because we're now recognizing I need to change this person's structure. Where is their center of mass? What are their ribs doing? What are their pelvis doing? We need to start to shift that. That's the foundation of the human body. And if we can start to change the foundation, we always get better results on the first and second floor, aka our legs and our arms, which is potentially another complaint that they're dealing with. So think about that. Once we treat the patient for their structure, we now get them long-term results. Why? Because everything we've done is to help increase their movement variability, and it's specific to them. It's not specific to low back pain. It's specific to their structure. If that person came in with a flared rib cage and living in extension, we taught them and cued them how to effectively change that by giving them strategies that increase their chances with positions, with breathing, with exercise selection, with intensity. All of these things that we can get crazy specific on, that if we have low standards, we totally overlook it. When we get long-term results, we get PT fulfillment. We're now fulfilled. Why? First off, we're not doing the same thing. We're doing different things. And even if they are the same, we're coaching it in a different way. That variability is going to help combat burnout. Number two, we feel fulfilled because we get long-term, life-changing results. If you can get life-changing results for your patient every single day, how good are you going to feel? You're going to feel amazing. You're going to want to keep that feeling. It's going to remind you why you got back into the field in the first place. So that's what we're talking about when we are understanding and trying to raise our standard of care. The big takeaways here are that we're not just identifying tightness and weakness and then just stretch and strengthen. We're understanding what pattern or position is this person in that I can favorably change. They're here because of a pattern. I need to change that. Next, we treat the structure. What are the ribs and pelvis doing? How do I start to increase the movement variability of the ribs and the pelvis? So that way we can build stronger legs, stronger arms in a better position. And lastly, we get long-term results. Long-term results because we're actually giving the patient what they need. It's not a guessing game. We know what they need based off their assessment. We identified their pattern, their position, and we know exactly which exercises to give them. So I hope you found this eye-opening. And like I said, if you are on the lower standard of care, that's okay. It's really almost inevitable. The way that the structure is, it almost happens to everyone. So it's normal. But let this be the video that increases your awareness, that shifts you from being over here and shifts you to go over here. Now, if you're confused as to how we start identifying patterns and positions and giving people exercises based off their structure, then I want to invite you to the Clinical Coaching Foundations course. I designed this course because there is a need. We need to raise our standards, and we're not given the clinical coaching aspect in school, in our education. And so there's a big gap. And the faster you can fill that gap, the faster you can feel fulfilled, the faster you can get long-term results, the faster you stop guessing with exercises, the more confident you feel with your assessments, and the overall higher standards that you're going to have. So if that's something that you're interested in, I'll go ahead and leave the link below. Check out the website, see if it's a good fit. I would love to have you. Let me know if you have any questions in the comments below.